Hello, everyone. Thank you for joining us tonight as we present our tele-town hall on what parents and guardians should know about the COVID-19 vaccine. I am Tanisha Short, Coordinator Team Lead with the School Support Unit. I will be the moderator for tonight's tele-town hall. For the last 11 years, I've served as an educator at both the K-12 and collegiate level. I have an immense passion for diversity, equity, and inclusion. Thank you all for joining us today. We hope this tele-town hall is informative and you leave feeling like an empowered ambassador ready to advocate for your children and families. We have two panelists joining us this evening. Dr. Percita Ellis was born and raised in Washington, D.C. She attended undergrad at Duke University and earned her medical degree from George Washington University School of Medicine. She also has a degree in adult and child adolescent psychiatry from the University of Florida. Dr. Ellis has a passion for healthcare in Hispanic communities, rural communities, and military families. She was a captain in the U.S. Army and is currently a pediatrician at Rockbridge Area Health Center. In her spare time, she enjoys photography, traveling, hot air ballooning, and has been working on getting her Class A license in skydiving. Thank you, Dr. Ellis, for serving as our subject matter expert. Michelle Mullins grew up in Roanoke Valley. She is a mom and a former teacher. In 2012, Michelle served in a Title I school as an instructional assistant, assisting students with improving their reading comprehension skills. In 2017, she transitioned into the role as first grade teacher. Currently, she serves as a school liaison for the COVID-19 School Support Unit, serving Southwest Virginia. She graduated from Hollins University with a bachelor's in biology and a master's in education. Thank you, Michelle, for being a panelist tonight. Before we begin, the vaccination is the parent and guardian's choice. Our goal is to empower parents and guardians and caregivers with accurate, up-to-date information on COVID-19 and the vaccination to make the choice for their child or family and address common parent concerns. VDH strongly encourages all parents and guardians to trust the advice of their child's medical health care provider. Vaccination is recommended by the Virginia Department of Health, Governor Youngkin, and the American Academy of Pediatrics, in addition to the Center for Disease Control and Prevention. Our objectives for tonight: we will share the benefits and risks of your child getting the vaccine, what parents and guardians need to know about the vaccine, the importance of staying up to date on all vaccines, and how to prepare your child for their COVID-19 vaccination. And without further ado, we will begin tonight's tele-town hall.
So let's go back 2 years. Dateline, Friday, March 13th, 2020. Friday the 13th. Children that are currently 5 to 6 years old were actually in 2020 leaving their Head Start, pre-K, or even preschool classes for the weekend. Children that are currently 7 to 11 were leaving for the weekend from kindergarten to 4th grade classrooms. Little did anyone know that, in fact, that would be their last in-person day for the school year 2019-2020. Then we also started learning lots of key words as an integral part of our vocabulary. For instance, masking, social distancing, metrics, quarantine versus isolation, all this in conjunction with the COVID pandemic. Now, initially, there were some that thought, great, we can actually have uninterrupted quality family time together. This is awesome. Then, as the days turned into weeks, weeks turned into months, spring turned into summer, some were now starting to experience a little bit of cabin fever. So, the benefits of getting your child vaccinated. Vaccines are safe and effective and can protect your child against serious illnesses. Currently, the COVID-19 vaccine is available for children ages 5 and up. Next slide, please. So there are 5 things that parents and guardians need to know about the COVID vaccine. First of all, as I said, they're safe and effective. And in fact, they have not seen any serious adverse events in large numbers of vaccinated individuals. The CDC continues to monitor that though. Now, the vaccination protects your child, your family, and your community. Furthermore, the COVID-19 vaccine is free and readily available. How many things nowadays are free? Finally, vaccination allows the children to attend school and other activities. For instance, if you're a child that was vaccinated and you were exposed to somebody who was positive for COVID at school, as long as you don't have any symptoms, you can continue in-person school without having to quarantine. Children can get the COVID-19 vaccine along with all of their other or any of their other routine immunizations that they're due for. That would include flu, MMR, varicella, etc. You don't have to make a separate appointment when you get that COVID vaccine, whether it's the first or the second. Next slide, please. There have been some concerns about the vaccine that many have wondered about. So let's look at those. For instance, will the vaccine affect my fertility? I want to have kids. No, the vaccines will not impact anyone's fertility and ability to become a parent. In fact, the American Academy of Obstetricians are actually recommending that women that are pregnant or thinking about getting pregnant, get the vaccine. So was the COVID-19 vaccine rushed? Actually, no, it wasn't. In fact, even before COVID-19, there were scientists that were working on other vaccines for the general coronavirus. So in fact, these vaccines were developed following strict FDA standards. So will the vaccines alter my child's DNA? No, the vaccine cannot affect anybody's DNA. And also it won't cause you to be a magnet, which is another thing that's been thought. Finally, can the vaccine cause COVID? No, the vaccine cannot give anyone COVID-19. Now, children may have some side effects after the vaccination, such as sore arm or a little bit of a headache or just tired, but they don't get COVID. And these are normal signs that your body has when anytime you get a vaccine as it's building protection. Next slide. But don't just take my word for it. Let me introduce you to the COVID-19 vaccine in this video.
Hi there, I'm your COVID-19 vaccine. You might think I'm new, but I'm only here because decades of scientific research and clinical trials made me possible. When Edward Jenner discovered the first smallpox vaccine, George Washington was president. And scientists have been continuously improving vaccines since then. For instance, do you know anybody who recently got polio? The polio vaccine basically wiped that disease off the US map. So, next time someone says I'm too new to be trusted, remember, researchers around the world have been building on the science that made me possible since long before you were born. And when science says you need a booster to help me stay effective, that's been tested too. And it's not just for us grown-ups. All that research and testing show the kid-sized vaccine doses for younger children are also safe and effective.
And that's a fact, Jack.
So let's move forward and get vaccinated, Virginia.
Yes, let's get vaccinated, Virginia. Now we will hear a teacher testimony from Ms. Michelle Mullins, former first grade teacher with Roanoke County Public Schools.
Thank you, Tanisha. As Dr. Ellis said, our lives got turned upside down in the classroom on March 13th, 2020. We definitely were not prepared. Teachers, students, parents, we had to completely go virtual, and our lives changed from that point on. I was very lucky, though. In fall of 2020, I was able to get my littles back on a daily basis. However, there were mitigation strategies such as the social distancing that kept us 6 feet apart. So we couldn't go to other classrooms. We couldn't go for lunch in the lunchroom. We had to have art and music and library in my classroom. And one of the saddest things I saw is my class couldn't even play with the other first grade classes on the playground. We were kind of confined to our own little bubble. The masks I noticed, and some of the other teachers I work with, we noticed that it did impact them emotionally because they couldn't play with their friends freely, and it was hard to read their facial expressions. Another thing that we saw was academic readiness. Due to the mitigation strategies, we weren't allowed to have small groups. So it limited the ability to have individualized instruction for the first graders, which is such a vital part of their education when they're learning to read. I needed to be able to meet them on their level and differentiate, and I couldn't do that because I had to teach the class as a whole. The masks, once again, they made it hard for them to learn how to correctly enunciate sounds and make blends of letters. And it really impacted their reading levels. And this was shown, it's shown through data that PALS assessment, which is a phonological awareness literacy screening. It's done in 131 out of 132 districts in the state of Virginia. And the assessment is done to measure and ID students at risk in grades K through 3 for reading difficulties. And if you look at the data that PALS showed, the spring of 2019 pre-COVID versus a spring of 2021, there was a significant increase in students ID'd for having reading difficulties. And it's definitely shown in the classroom. But thank goodness, with the vaccinations being approved, students are now able to stay in school and continue learning and get the instruction that they truly deserve. And it's so important for them to get vaccinated because it offers the safest way to build immunity, and it allows them to continue with their normal activities and daily lives. So I really just want to thank you for letting me give this brief synopsis of what I've witnessed over the past couple of years. And now I would like to go to the next slide to share with you how COVID continues to affect children's lives. So COVID-19 infection, it affects children's lives every day. It affects them educationally, socially, and their physical activities. COVID-19 infection poses a risk of serious illness and hospitalization for children, even though it is significantly lower than the risk to older unvaccinated age groups. Children may also develop long-term illness, such as multi-system inflammatory syndrome, MIS-C, or long COVID. So vaccinations are the best way to protect our children so that they can get back to their everyday routines. Now, I want to turn it back over to Dr. Ellis to discuss some vaccination concerns.
Thank you, Ms. Mullins. And let me also say that our teachers were one of the personnel that are on the front line of the COVID pandemic. Remember, school is one of the main places that kids go to. And without the teachers having the consistency and structure, the students really did suffer. Now, next slide, please. So one of the big things that has been in the press or social media, any other place you get your information, is regarding concerns about myocarditis and pericarditis and its relationship to the COVID vaccine versus the COVID disease. So for instance, first of all, pericarditis is inflammation of the outer lining of the heart, while myocarditis is the inflammation of the heart muscle. Now, very rarely have myocarditis or pericarditis have been reported after COVID-19 vaccine. There one instance is, for instance, primarily male adolescents and young adults. And a lot of times they'll feel the chest pain, discomfort after about a week or so after either their first dose or usually their second dose. However, the risk of myocarditis from COVID-19 infection is much greater than the risk of myocarditis from the vaccine. In fact, one study found that getting myocarditis from the infection was 13 times more likely than getting it from the vaccine. And furthermore, when you get it from an actual infection, it can last a long time. Kids are often out for a full season of their athletic team. So also the CDC continues to actively monitor these reports to learn more about it. But as of now, there has been no incidences of myocarditis, pericarditis in the 5 to 11-year-olds. Next slide, please. So what is the process of COVID-19 vaccination for children? Well, children ages 5 through 11 years old receive an age-appropriate dosage of the Pfizer BioNTech COVID-19 vaccine. Now, I said age-appropriate, not weight-appropriate. And in fact, 5 to 11-year-olds get 1/3 of the dosage that is given to children and adults that are 12 and above. So when your child needs a second dose of the shot, again, it's usually 3 weeks after the first. So suppose your child is 11 years old, gets the COVID vaccine, the first dose, and then turns 12 before it's time for his or her second dose. Which dosage do they get? Well, remember, I say it's age related. So in fact, once they turn 12, they get the dosage that's for 12 and above, and that's not a problem at all. So now children 5 and above that either have moderately or severely immunocompromised, whether cancer or renal or any of those illnesses that can result in that, they actually should receive a 3rd primary dose that's actually given about 28 days after their second dose. Next slide, please. So let me introduce you to 2 friends that are going to tell you how COVID vaccines actually work.
Vaccines work like invisible coaches. They partner with your child's immune system, teaching it how to stay strong and healthy when exposed to viruses and other threats. Vaccination is one of the most effective ways to protect your child from preventable diseases and to help them thrive. While some people are just hearing about them now, vaccines made with messenger ribonucleic acid, or mRNA, have been studied for decades. Unlike many childhood vaccines that contain tiny parts of a virus or bacteria to train the immune system, mRNA COVID-19 vaccines don't contain any parts of the coronavirus. Instead, they teach the body to recognize the virus in the future. The mRNA in the vaccine teaches your child's immune system to do what it would normally do, but faster and better. As soon as the vaccine is injected into your child's upper arm, it goes to work. You've probably seen pictures of the coronavirus, a ball covered in spikes. Vaccines using mRNA teach your child's body to make spikes out of proteins. These proteins look like spikes on the virus that causes COVID-19, but aren't actually the virus. Your child's immune system recognizes that the spikes shouldn't be there, so it produces antibodies that eliminate those spike proteins. The antibodies then remember what to do if your child is exposed to the virus in the future. This all happens very quickly. After the mRNA in the vaccine instructs your child's body how to make the spike protein, it's broken down in a matter of hours. A second vaccine dose about 3 to 4 weeks later reinforces the earlier instructions so that the immune system prepares itself even better. 2 weeks after your child gets the second dose, they are considered fully vaccinated. Most vaccinations, including a COVID-19 vaccination, can sting. Some people have a sore arm afterward. Just like adults, some children may experience fever, chills, headache, or nausea. Those side effects go away quickly and are a sign that the immune system is learning how to protect the body against the virus, similar to how your muscles feel sore after a workout. Serious side effects from vaccination are very rare. Of children who do experience side effects, most feel back to normal in a few days. If your child is fully vaccinated, they are far less likely to get infected. Or on the rare chance that they get COVID-19, they're far less likely to become seriously ill or die. COVID-19 vaccination gives peace of mind because it greatly decreases the risk of COVID-19 infection. Like a good coach, the vaccine does its job, and your child will be in good shape, ready to thrive.
Next slide, please. So how can I prepare my child for vaccination? Give your child time to process the information, to ask questions, and to prepare. For teens, a week or two in advance. For older school-age children, a few days in advance. And for the younger children, 1 day in advance. Explain the need for vaccination. We need this vaccine because it will help us stay healthy and help us keep our family and friends healthy. Make a game plan. Practice getting the shot. For example, deep breathing, watching a video online. Ask your child, do they want the shot in their left arm or their right arm? Let them have a little bit of ownership over getting the shot. And be honest, they're gonna feel a quick pinch. So next slide, please. Conclusion, the benefits of the vaccine outweigh the risk. The benefits: protects from serious illness, reduced risk of hospitalization, reduced spread, and reduced risk of death. The risks: there may be mild side effects and rare adverse events. Now I would like to turn it back over to Dr. Ellis, and she is going to address some frequently asked questions.
Thank you.
You're welcome.
So when we're looking at the COVID vaccine, again, there are several questions that people have if they've seen on social media or whatever. So for instance, why not wait longer to get the vaccine, especially since the cases are going down? Well, the reason you don't want to do that is because the fact that getting the vaccine will help you protect you from the core symptoms that can come with COVID. Now, granted, even though the cases are going down, we're also going to be cutting back on our mitigation factors. For instance, there will be less masking, less social distancing, things like that. So guess what? Those that aren't vaccinated, there's a chance that they could now get the disease. So can you get either your flu shot or any other immunizations when you get your COVID vaccine? Definitely. You can get your other immunizations with either your first or your second COVID vaccine. And remember, it's very, very important that the other immunizations that are required are given at the appropriate time. So what is a COVID-19 variant? Does the vaccine still protect against it? So basically, a virus has like a core that's kind of the central core for the whole family. And then each virus may have little attachments that are a little different. And these are what causes the variants. So as I said, the vaccine overall will prevent the core virus, but there may be variants come by that it's only a little bit protective. You still won't get very sick, but you may just have some very mild symptoms that don't last long, they go away quickly. So yes, the vaccine still does protect against COVID-19. Now, some people say, well, my child already had COVID-19, so he's got natural immunity. We don't have to worry about it. Well, actually, natural immunity from actually having the disease is only lasting about 90 days. Of course, we're still studying this and looking at it, but it's been found only lasts about 90 days. Whereas if you get the initial full series of the COVID vaccine, you will actually have immunity for 6 months. And then when you get boosters, your immunity will even be longer. So how soon after testing positive can my child get the COVID vaccine immunization? Well, if a child tests positive, remember they have to, and they haven't been vaccinated, they have to be in isolation for 10 days. And after that time, as long as they don't have any symptoms, they can go on and get the primary series of the COVID vaccine. Next slide, please.
Thank you, Dr. Ellis, for answering those frequently asked questions. We will now open it up to questions from our audience. Please feel free to unmute and share your name, your location, and the question that you have for Dr. Ellis.
Hi, Dr. Ellis. My name is Dara, and I'm a mother here in Southwest Virginia. I'm actually at a baseball practice right now. I've had my children vaccinated, and they've had both doses. So is it still necessary for them to get the booster?
Good question, and I'm glad you were able to get to that baseball practice. That's what we get for vaccinating our children and adults.
Absolutely.
Yes, so basically the primary immunization series was felt that it would have been effective, but we started having variants. So as I said, the primary series has now been only found to be effective for about 6 months. Again, we're still looking at it, we're still researching it. And so with the onset of the variants, it was found if they get the booster at the appropriate time, their protection bumps up again. So it really is important that they get the boosters.
Thank you.
Hi, Dr. Ellis. I had a question. My name is Nathan. I'm coordinating with the schools in the Northwest region of Virginia. Clinical trials indicated the vaccine was 90% effective, and now I hear the effectiveness is much lower. What is the actual protection for children once vaccinated? Are children going to get a higher dosage in the future to boost their effectiveness?
Good question. So initially, like I said, they did find that they thought that the vaccine was 90% effective against the core, what they thought was COVID-19 virus. But we started having variants. Remember, we had the Delta variant, we had the Omicron variant, and several others. So they actually found that the vaccine was not as effective as initially they thought. But if you added a booster to it, just like some of your other immunizations you get boosters for, if you added the booster, the protection actually was extended farther. Now, with regards to having to get an increased dosage, as of now, that's not the case. In fact, sometimes the boosters are half the dosage of your primary series. Now, remember, the one time when you will get an increased dosage is when you go from being 11 years old to 12 years old. 12 and above, they get 30 microgram dosage, whereas kids 5 to 11 get 10 micrograms. Again, a third of the dosage of the adults.
Thank you.
Thank you, Dr. Ellis. Do we have any final questions from our audience?
Hi, Dr. Ellis. My name is Danae, and I'm a math interventionist. I have had several children quarantined due to possible exposures, and I've seen some children from the school, even though they were not required to quarantine, if they were experiencing or showing symptoms. So my question is, if a child was scheduled for a vaccine, but showing signs of infection on the day of the vaccination clinic, should we hold off their vaccination until the child is better?
That's a very good question. So basically, for instance, if a child has a fever, cough, vomiting, diarrhea, anything that basically looks like an illness, it's probably best to hold off on giving the COVID vaccine that day. Remember also, the fact is, suppose you give the COVID vaccine and they just basically get sicker only because of their illness that they had. They'll always be saying, I'm not getting the COVID vaccine. I got that thing and I was sick as a dog. So what we usually recommend is that you wait until they're better. Now, there is one exception. Especially nowadays, we're seeing a lot of seasonal allergies and things like that. You can get the COVID vaccine while you're having seasonal allergies. So the biggest things are looking for fever, vomiting, diarrhea, anything like that. That's when you'd hold off and wait.
Thank you.
You're welcome.
Thank you, Dr. Ellis, for answering our questions. And thank you, Ms. Michelle, for sharing the classroom perspective. And thank you, our audience members, for joining our teletown hall on vaccine hesitancy. To schedule an appointment for you or your child, please visit vaccinate.virginia.gov or call 877-VAX-NBA to find a clinic near you. Stay healthy, Virginia, and take care.